All right, good afternoon, everyone. Happy to see we got a really good turnout yet again for another partner showcase webinar here today. I know we're right at the top of the hour here and probably still have a few more attendees trickling in as we go. But yeah, happy to have everyone on today, and I'll just do some quick housekeeping before we kind of turn it over to House Mom here. But just to recap really quick, if you don't know me already, my name is Steve VanderVelde. I'm the Director of Senior Living Partnerships here at ProviNET. That means I get to work really closely with a lot of our vendor partners like House Mom, which we're going to learn a lot more about in just a minute here. But I also help, scope out some of the project work that we do here at ProviNET. Any senior living communities who are looking for outsourced IT services, EHR implementations, or any engineering projects to help kind of boost up their infrastructures. A lot of different ways we plug in with senior living providers across the country. And one of the ways that I'm most excited about is just helping advise providers on just what solutions are out there and what needs are being filled by some of the vendors in the space that we think everybody can really benefit from. So that's why we're really excited to be launching our partnership with House Mom today and having this webinar to let them kind of show a bit more of their solution and where they're plugging in. This is a topic that I think we have a good amount of interest in across our customer base, as well as just in the industry. And we have a lot of clients asking for recommendations on solutions like this. So over the last few months, we saw House Mom perform really well in a lot of our mutual customer base, and it made a lot of sense for us to go ahead and partner. So, really quick, House Mom and their unique family communication portal, we've seen it drive a lot of positive ROI within the communities, improves care quality, and helps support documentation compliance. And what's nice about House Mom as well is it's fully integrated with a lot of the leading EHR vendors in the space, specifically Point Click Care and Matrix Care, and requires very little setup and training, despite having such a huge feature set. So it's been a big help for the staffing element, which is a big focus for us at ProviNET today, is any technologies that can help staffing. So from here, I'm happy to introduce Bob Cummings, the Vice President of Business Development at House Mom, and have him introduce the team and kick things off. Bob?
Thank you, Stephen. Hello, everyone, and welcome. Before I introduce our team, I'd like to take a moment just to thank Steve, Scott, and the entire ProviNET team for all of their activities working with us to set up the partnership and for coordinating today's session. Turning it over from here, I'll be introducing Justen Spirk. Justen with an E. Justen heads up our business development team. He's going to take you through a solution overview. From there, I'll introduce Matt Prasek, our CTO and co-founder. Matt's going to provide you with a demonstration of the House Mom platform. So with that, I'll turn it over to Justen.
All right. Just to begin, Steve, thank you for the gracious introduction. I know that everyone here at House Mom is really excited about the partnership with ProviNET. And Bob, thank you for spelling the name correctly. I do appreciate that. So if everyone can see the screen here, we'll go ahead and just kind of kick things off. I think it'd be best to start with, what's in the box? What are we really talking about? So House Mom is a communications platform that, more specifically, what's in the box, it's a platform designed to share clinical and other information connecting families, practitioners, staff, residents, all seamlessly under one platform with no additional burden to the facilities or the staff. So the platform is broken down into two pieces, what you can see on the screen. On the left, you're going to see the communications piece. Now that's available via app, Android and Apple, web, email, and text. On the right, you're going to see the Connections Hub. Connections Hub is what enables and documents communications with residents, families, staff, and care teams. Think of this as your automated control center to easily manage all communications. Whether it be by text, email, web, or the House Mom app, families can access their loved ones' information at their own convenience. With the help, we help to make sure that the right person receives the right information at the right time, always. House Mom is completely configured to serve the type of care settings that all of you are in currently. We've seen this across the board with our customers currently. Okay. So what if I told you we offered a platform that helps everyone in your org? We were able to do that through transparency. Transparency makes sense, whether that be with the residents, the families, the administrative team, care teams, or marketing. Family communication improves ROI, care, and compliance. Making resident information more accessible to the residents and families builds trust while providing peace of mind at a time post-pandemic when guilt and fear of placing a loved one in a facility is at an all-time high. I think everybody can agree that the media coverage of the industry during the pandemic did us no favors. And on top of that, we're now dealing with a staffing crisis that's only amplified the feeling. With House Mom, you're optimizing nursing time to care for residents without sacrificing family satisfaction by relieving care teams of distracting and routing tasks. I mean, currently, the way that most facilities are providing information to families is cumbersome, inefficient for both the staff and families. For example, if you have mom or dad residing in Sunny Acres, you need information on a lab report. There's multiple steps you're going through. Number one, you're likely Googling the facility for the phone number. You're going to call the front desk. Then you're going to get redirected to a nurse's station, passed to the primary caregiver. They'll authorize you over the phone. Then a nurse is going to log into the chart. They're going to tell you the information you needed, then let you know that you can come to the facility and pick it up. All of these have an average of at least 3+ touches. There are more than 7 actions and a minimum 30 minutes. This takes up valuable staff time, which they don't have, and your families hate it. Worst of all, most of these types of communications and updates to the families go undocumented. A more effective means to communicate reduces staff burnout, allows the team to focus on care, and care teams are constantly being asked to do more with less, making it hard to focus on those most critical tasks. So convenience, peace of mind is really important to residents' families. If you can give them convenience and create that peace of mind, they're going to thank you for it. And it's often going to happen online. We help to direct those family members and not take your time. Our customers see increased online ratings through Google, Facebook, Yelp, etc. All the families are now looking at online scores for communities, and that's a metric we've shown to improve. Families want their loved ones to go to a House Mom community because of the convenience and peace of mind provided. We are focused on building that network of communication that becomes a standard of care for long-term care facilities. So putting those connections to work. So within this slide, you're going to see 4 different sections here, and I'm going to touch on these a little bit differently. But to just walk through those quickly, number 1, we can increase admissions. 2, we're going to save time for your staff. We're going to increase or amplify the better outcomes. And then at the end of the day, you're going to be compliant through your documentation. Now, there are numerous ways we've worked with our clients to increase their admissions. But first, we have to ask some tough questions. Number 1, do you want more family feedback? Now, typically when I ask this question to a facility, that answer is a resounding no. But your families do, and that data is gold. The next question you have to ask is your staff good at listening? And then lastly, what about documenting it? For family feedback to drive ROI in a community, your families need to have a voice, and your care teams need to have a tool to make them more effective listeners. Listening to your families improves care and experience for them and the resident. Families want to have a voice. If you give them a channel to provide feedback, they'll use it. We know it. Every facility I walk into can tell me off the top of their head those family members who are the quote unquote frequent flyers and demand the majority of staff time. They're the first to let you know that you're doing a bad job. They're the first to let you know that you're doing a good job. But that channel for feedback needs to be internal and automated so that it is a tool your facilities can utilize to drive ROI. The feedback needs to be visible. Staff needs to be alerted when families provide actionable feedback. We work with our customers to develop service line agreements and service recovery processes. Don't be afraid of the data. It will help to improve ratings, increase referrals, reduce resident turnover. The data available and the platform can help your organization put together a winning strategy at an enterprise level. So how do we communicate with families? Are your social workers calling hundreds of POAs a week? I know from my own personal experience, my wife has been a social worker in long-term care for 18 years, and I hear about it when she gets home. Most often, communities will reach out to the families only when there's bad news. This creates unintentional negative perception of the facility. Communications with families must be consistent and documented. This is where we see a lot of facilities fall out of compliance. An easier way to communicate, an easier way for communities to automate the communications through notifications. Your families will love this as long as you make it convenient. Some of your families prefer text, some prefer email, some are going to prefer the app, but allowing them to receive the information in the way that they want it will give them that convenience they desire and help to boost those satisfaction scores. So connecting external care stakeholders, much like you do your families, helps to boost your referral network. And we see this with all of our customers across the board. They're using this platform as an opportunity to boost those referral networks. We help to strategize with our customers to make data convenient for all of these roles. How's Mom can be a great way to build confidence within your network that the resident is receiving the best care and everyone is striving towards the same goal. Involving hospitals and getting your sales and marketing on board to help drive awareness is part of your care team connection package. So we've seen different types of care settings within long-term care, putting together ways to mass communicate effectively. Finding one platform that allows you to do this across what matters most, the residents, staff, and families, can help save you money and time. Oftentimes, a lot of the communities are using 3 to 4 platforms to communicate across their staff. They send out family notifications in one, resident family engagement in another, collect family feedback from another, etc. Managing all these platforms with different logins, permissions, can be a job in and of itself. We need to change communications with your families and get rid of the noise. Having your families call to collect basic health information and other non-critical requests is a losing strategy. Bottom line, you want to drive the right type of engagement. Now that's going to save you and your staff time. Identifying what your families what your families contact your communities about and making that information available will save you hundreds of hours. Then automating the documentation is just the cherry on top. With your staff, much happier in taking those family phone calls and being able to discuss with them what they can do best for the resident. That's what matters, and that's what everyone's here for. So How's Mom is a differentiator to communities by encouraging engagement, enhancing reputation, and building census. The How's Mom network is growing quickly, becoming a standard of care. Residents and family are now expecting this type of convenience and communication in a post-COVID world. I mean, let's all face it, that's what we're looking for here. Many of our clients are leveraging our network and utilizing the platform as a census building tool to achieve these type of results. So to ROI. So there's 2 times the satisfaction score increase, reduced call duration from 21 to 4 minutes, and over $32,000 in labor cost savings. Bottom line, better communications are driving better health, operational, and financial outcomes. It's easy. Implementing these strategies across residents, staff, and families will use the technology we've seen results like in 6 months. So we had one of our customers do an independent case study. It's a 60 facility provider with a number of different types of care settings. They went ahead without our knowledge and A/B tested a total of 12 buildings. So 6 used the platform and 6 didn't. The 6 that used the platform more than doubled their Google and Facebook online scores. The 6 that didn't actually decreased. So I'll say that again. So 6 that used the platform doubled, and the ones that didn't actually decreased. You can drastically improve on saving staff time, up to 55 hours per month. I know that sounds crazy, but please feel free to reach out. Love to get into more of that conversation. But that's all done by making communication more effective and implementing mass notifications. It is a simple and easy process, but it's something that the industry in general just hasn't really taken on as of yet. Resident, staff, and family communications pays for itself, bottom line. So care improvement. So more time for care, more family insights, better care team and family collaboration. Period, resident care is the most important thing. That's what we're all here for. Allocating the majority of staff time to that is critical. Being able to aggregate family data in a way that doesn't take your staff time and provides them a tool to quickly notify the right person when it's important, lead to better care outcomes and satisfaction. Okay, move on to compliance. All communications documented, care plans shared with context, and a single source of truth. Having a communications platform fully integrated with your EHR provides compliance. Any communication through the House Mom platform is documented back into your EHR. This saves your staff time and provides peace of mind to the facility knowing that your communications have been documented. So, wrapping up my portion with the customer experience, House Mom, here are a couple quotes from our customers, and one that is really my favorite from a specific care team member. House Mom absolutely creates more referrals. We've seen this across all of our customer base. House Mom has been a lifesaver. Again, when implementing the platform and the efficiencies that you see almost immediately from just the dramatic decrease in call volume, it's just apparent from the get-go. And then lastly, my favorite, I pay for the House Mom app out of my own pocket if I had to. That comes directly from a nurse. I think that's probably the most telling as far as the amount of time that we can free up for them to do the job that they were hired on for. So over the past several years, we've been working to develop a formula that impacts outcomes. And what we found is that sharing that information across residents, staff, and families, not only has it had a positive impact on care, but it's providing your residents, staff, and families with a level of satisfaction that, to be honest, is not often seen in the industry. So with that, I'd like to wrap up my portion of it and hand it over to Matt for the product demo to hopefully shed some more light on what I've just talked about.
Awesome. Hey, everyone. Appreciate your time here. I'm going to toggle over real quick to our demo. I'm pretty excited to show you guys today the platform that makes all this possible. So, when we look at House Mom, we have a variety of different ways that we communicate that Justen touched on. We're really focused on helping our care providers, whether that's assisted living, independent, or skilled, communicate across three critical populations. That's their residents, staff, and families. And we have a variety of different ways that we do that. One of the most popular is the House Mom app. Justen mentioned we're building a large network on there that family members and the staff love. Just an easy way to be able to receive information. But also, the way that we make this all possible is our Connections Hub, which you're viewing here. We make it completely configurable, so you're able to communicate the information, how you want to communicate, and who you want to communicate it to. So based off of what you enable, is the different types of ways that you can communicate. As I mentioned, we have email, we have text, we have app, push notifications. I mean, just really a wide form of communications that can go to your residents, staff, and families. And we do this very easily. We don't change any of your processes. We work with you, an account manager will work with you, and either at an enterprise or facility directly, and really identify what's important to you. What is tying up your staff? How can we unblock information to allow them to focus on giving care? How can we collect feedback from your families more efficiently and give your care teams the tools to be able to address the feedback that they want to? And then allow you to track all of this information and automatically document it. So, for example, We talked about social workers calling POAs. We have the ability for your staff to come in and send mass notifications very easily. We were involved with some of our Florida facilities during the Hurricane Ian, sending out evacuation notices, just one place to go to very quickly that's connected to your health records, doesn't require you to gather contact lists. It's very seamless, and to send out a notification and have that documented and push back into your health records, so that's a source of truth. You know, that's kind of the convenience that we can bring to a lot of our care providers, and also helping them communicate more effectively to these parties, collecting feedback. You know, Justen mentioned the data, being able to more effectively use that data that you see here, having that channeled, automated, coming to one place, making sure that people within your facility are receiving automated alerts. They can respond directly to the platform. We can help work with your teams and develop strategies to be able to do service recovery, but more importantly, being able to have that data to know internally, to utilize it as a tool to see what your facilities are good at, what we can improve on, and being able to look at how that's impacting census. You know, that's really the tool here, is to be able to aggregate this data and utilize it in a meaningful way, so that your tool is looking at, you know, customer satisfaction much more effectively. And we will jump right back into the presentation here. I'm going to toggle back real quick. Awesome. I appreciate you guys allowing me to show the platform. So just to highlight a little bit, you know, of the platform, very customizable. What's important to different types of our clients and customers may vary. So, you know, for example, in skilled environments, they may be more clinically focused and want to learn how they can more securely share health information to necessary stakeholders, versus assisted living. You know, we may be more focused on engagement type activities, where we can share activities calendars. We can create virtual care planning environments all through the House Mom app, and help you document those types of communications and engagements. Fully automated, you guys already have it. Through our integrations, you just turn us on through your health record systems, and the implementations are very easy. You know, we work with you to really align with your workflows, no change of processes, quick implementations, deployment in 90 minutes or less. We'll work with your facilities and train them specifically. We'll handle all of the support on the House Mom app for your families, which, by the way, 90% of the time it's password resets. That's how intuitive our software is. And we'll handle all of that support for you. Have dedicated support lines, not only from the family perspective, but also from the facility perspective. We'll also allow admins at the facility to utilize self-guided tools. So we have tours. We help give frequently asked questions. You know, really provide a knowledge base for your facility admins to know how to go and send mass notifications, how to communicate different items, how to enable activity calendars and things like that. Customer service, dedicated support lines from a facility perspective and a family perspective, knowledge bases as well on both of those. So your families have a network that they can tap into to learn how to utilize the app. They have support as well, whether that's form support, being able to send a form and quickly get responses, or a phone number that they want to call. We'll have people that are available to talk to them and walk them through any challenges that they may have from an app perspective, or, you know, emails, texts, you know, the web-based app. whatever is convenient for your family members. We have that dedicated support element to walk them through any challenges they may have, as well as your facility admins on the Connections Hub. If they're looking at, to enable new features or want to learn how to do staff communications, we're very easily able to walk them through that, how to enable it, and support them through. So lastly, just really summarizing what family communications can do for your facilities, improving the ROI and care outcomes compliance, all of these areas that we really focus on, helping your facilities document. But I think, one of the things that we're most excited about is creating that patient-centric care experience and giving the resident the best possible outcome. Awesome. Let's just jump into questions, and appreciate you guys allowing Justin and I to go through the presentation.
Mm-hmm. Yeah, and thanks, Justin and Matt, for kind of covering, some of the context around what benefits we're seeing with the solution, as well as the demo there of just, what that product actually looks like. And I forgot to say at the beginning of the webinar, for all the audience members we have on today, please, we want you to ask any questions that you have today. We dedicated, pretty much half of the webinar to just going through what it is and having that demo, and we're hoping to have the other half more so dedicated around questions. So any questions that you have come up, I know all the lines are muted, but there should be a question pane on the GoToWebinar controls that you have. If you just start typing questions into that question pane or even to the chat, we're monitoring those, and we'll be sharing them with the House Mom team so they can answer any questions you may have on the product that came up. So I guess first, we got a couple questions coming in already, but I guess I wanted to ask my own question really quick, selfishly. So I guess from our perspective, here at ProviNET, we see a lot of communication platforms in the senior living space, and I think they're all focusing on kind of different use cases a little bit. Could you maybe expound upon what makes House Mom different in that regard, and what you think is a differentiator between any competitors out there or people operating in the same area?
Yeah, definitely. Thanks, Steve. One of the things that I think makes House Mom's approach different is that we're really focusing on residents, staff, and families. We really have something for everyone within the organization, whether that's, to more effectively communicate across your staff, your care teams, individual facilities or regional teams. Having that staff communications element is really important and can help really drive operations. We also allow, family members access to the app and let facilities control that, and, really allow them to share information more effectively and channel those communications and, drive things like different engagements and different things for different types of care settings, but also communicate to the residents. So I think that is unique. When we look at, the market, we see different tech platforms in different spaces, whether it's, a focus on just family engagement or just staff communications. And when we talk to a lot of the providers, we see that, they may have 4 or 5 different platforms, and, they're juggling different logins, different websites to go to, and then they have to train their staff, to be able to go to all these different places to do these different things. And what we've built at House Mom is really that overall platform to allow you to manage all of your communications and make sure that you're compliant 100% of the time, making sure that the right person's getting the right information at the right time is a core of what we do.
Awesome. All right. And we have a healthy amount of questions coming in, so I'll start kind of going through those from the top here. And first off, the question was just, can we share the slides at the end of the session here? And I'm sure that's okay from the House Mom perspective, but I was also going to say that we're going to This is being recorded, so we're going to be sharing this recording with everybody on the webinar today, and anyone who might have missed it. So it'll be on YouTube. You'll be able to share it with anyone, just you having that YouTube link. So should have access to the whole thing. All right, and then first question here is, what EMRs are we able to be integrated with for HouseMom?
Yeah, great question. Right now, we work mostly with Matrix Care and Point Click Care clients and customers. We have some other integrations on our horizon, and we're always excited to work with new partners. So if your facility utilizes a different health record system, let us know. We're happy to work with other providers there. But the majority of our client base is across Point Click Care and Matrix Care, which really covers a lot of the space.
Awesome. All right. Next question is, we are a smaller AL assisted living organization and do not have an active EHR. I'm assuming that we could not implement this program without an EHR. Is that correct?
Yeah, so we have a standalone product to where it's not dependent on a health record system. And, you know, it doesn't have all of the functionalities that we get to leverage with our integrations, but we do service customers today who are EHR agnostic.
Okay, awesome. Next question is, for residents that opt out, is there an option to exclude a particular resident? Also, is there a way to allow certain resident contacts to have access similar to the Point Click Care Connected Care Center, where they can exclude certain information based on the resident consent?
Yep, great question. Yes. So you're able to exclude residents and contacts, configurable all the way to the contact. So, you know, what you want to share with your care POAs may be different than what you want to share with emergency contacts, right? So typical use cases when I'm working with clients and customers may be setting up notification templates to be sent out via email and text to all emergency contacts, or, you know, different types of communications to go to a financial POA. But a care POA, you know, you may want to make clinical information available. So you're really able to configure what type of information goes to the specific role, down to the role, the contact, and the resident.
Yeah, I think the easiest way to put that is it's not a one-size-fits-all solution. The platform itself is very flexible and able to be manipulated to fit the facility's needs.
Okay, perfect. I have a more direct question here. Is HouseMom integrated with the NetSmart MyUnity product? Or any update on that specifically?
Yeah, today we're not currently integrated to NetSmart, but that has been one of the systems that we've looked at where we could expand our offering.
Okay. And the next question is around integrating with HRIS systems. Is there any integration available with those types of solutions to obtain things like team member names, departments, locations, etc.?
Yeah, great question. Yes, we've been looking at that on our roadmap to help with the staff communications initiative. I mean, it's much like what we do with Point Click Care and Matrix Care, of seamlessly pulling and gathering those contact lists and, you know, allowing our facilities to assign roles and permissions to them. So for example, you know, how I was talking about, they want their POAs to receive certain informations automatically. The same goes with our staff communications, and we're pretty interactive with a lot of our clients and customers, especially our early adopters of the platform, to where they help us design our roadmap. And that has been something we talk about with our clients quite often is, being able to pull over the staff roles more seamlessly to help with the staff communications. And we have some plans on further developing the communications piece to help do that.
Okay. Got another question here about pricing. How does the pricing work? Are packages based on number of residents or some other type of metric?
Yeah, great question. We have packages, 3 different tiers based off of the functionalities and data points that you want to be able to communicate across those populations. But also, we're able to work with smaller organizations or larger organizations, and there's different ways in that we do that. We haven't found that cross pricing has been a prohibitor. Because we have, facilities that are on the smaller side, 30, 40 beds, and then we have ones that are, 100 or even 200, right? And we're able to really fit those different types of environments for sure, based off of the configurations that we have.
Okay. Is there an interface, API/SDK, for non-EMR data that allows extension of the data available to family from third-party technology solutions?
Yeah, that's a great question as well, because we have been a pretty data-focused company, and we have been looking and discussing potential opportunities with third-party partnerships. I think, we get approached quite often because one of the things that we do really effectively is help deliver information to the families. And we've built a pretty large network nationally where, family members who have loved ones in long-term care have the House Mom app to download and go to. And a part of that is, different partnership opportunities, such as payment options, allowing family members and different technologies to utilize the channel to help them more effectively manage their bills, helping the healthcare providers, get tools to more easily collect revenue and things like that. And that's just one example, right? But yeah, we've looked at, how do we as an organization share data across our partner networks, and building an API, more structured and standardized API has been on the horizon because our partner program has been expanding thanks to the work that Bob Cummings has been doing.
Awesome. Yeah, that's really exciting. And just for the audience, please keep those questions coming. We still got a few more to work through, but want to make sure everyone can come away from here with making sure that they got a good understanding and don't have any lingering questions here. So next one is probably a follow-up from one of the earlier questions. Is there any ETA for a NetSmart integration? Sounds like somebody out there really looking for that, and any content there?
Yeah, I don't have a projected date that I can share today, but I think we work with our clients and customers a lot in that way. So if that's of interest and we have a NetSmart person interested in that, would love to connect and see how we can jointly approach them to be able to meet your timelines and expectations.
Okay.
Yeah,
awesome.
just to piggyback off that, I think that's the easiest way to drive those partnerships with different EHRs, is to have potential clients that are interested in the platform to not only come to us but then go to their EHR and ask for that integration.
Mm-hmm. Yeah, and I guess I'll add too, that's kind of been my experience working with other partners who are integrated with EHRs. It's always integrated with point click care and matrix care. I know NetSmart has a little bit of a different approach there. It seems they more so want to have so many customers of their own interested before they'll go through with that. That's been my experience in the past. So that I guess it shouldn't be a discouragement to any of the NetSmart customers on today, more so, hey, how can we, if you are interested in a solution to this, how can we begin to make some noise about making that happen with the vendor there?
Absolutely.
Okay. One clarifying question just came through that I suppose I can answer here, is more so, sorry I missed the beginning of the webinar. What's the relationship between ProviNET and How's Mom? I'll just say, ProviNET, we look to have a robust partner ecosystem. And when we allow partners into that, we want to make sure that they're addressing, unique and pretty large needs within the senior living vertical. So the solutions that we're talking about here today with How's Mom, those are things that have been coming up quite frequently over the last year and a half for us. And we've been talking together as two organizations, I think, for since last year's leading age. And as we kind of develop more and more mutual customers, that's where I think we said, hey, let's partner and make sure that customers of ours who are looking for a solution like this, that we have a good answer for them and can refer them to a trusted vendor in this space. Okay, next question is, do you provide a demo of the How's Mom app that shows the end user's experience, what the family or the resident would see?
Yeah, great question. We have that available on our website. Also, when you implement How's Mom, you have access, obviously, to what the end user experience looks like as well through your admin portal. So yeah, we do that quite frequently. It's a part of a lot of the training and facility of seeing the flip side of, hey, what does the family or resident and staff experience? So giving visibility to all pieces of the platform is really important to us.
Mm-hmm. Yeah, I think that's what kind of got me hooked right from the beginning, is seeing that app, in person last year, and playing with the tool that you have on the website too. That's been something I've kind of pointed to a lot when talking with customers. So definitely encourage people to visit that.
And I think, Steve, if folks are interested in that, as they reach out to you, we'd be more than happy to set up a demo to get a little more in depth on both the app itself and Connections Hub.
Yeah, awesome. Okay, another question. Is there any ability to share resident calendars, both group and individual calendars, to family members from Point-Click Care specifically?
Yes, we do. We support the Point-Click Care calendars to be able to share that, as well as one exciting thing that we have on our roadmap is if you don't have Point-Click Care's calendar, you can independently manage and share calendar events as well.
Okay, awesome. Another question here, I think, is more so around the element of family feedback that we kind of touched on. Is there any ways that that's being, uniquely used across your customers? Is that being used in, morning meetings, or can you talk a little bit more about how you're incorporating the family feedback that you're gathering from this?
Yeah, I'll take that one, Matt. So this is something that I hear very often from customers, and I've started to talk about this more and more often, is that the way that they're utilizing that family feedback is essentially in those morning meetings, like you just said. Every morning, they're sitting around the table, they're pulling up the Connections Hub and then looking at feedback from the previous day and identifying those time-sensitive requests that came in. So, I mean, that way they're able to perform that service recovery right then and there. They're identifying, a handful of folks that need to be contacted that day. And what's also interesting is they're starting to track how often family members are jumping onto the app. And something that I had never thought about was, hey, look at this one individual who's logged onto the platform 130 times in the last 19 days. Hey, maybe we should reach out to that person, understand what they're looking for, and what we may not be providing that they're interested in. So it's a great way to identify those family members that may be a thorn in your side or may just require a little bit more engagement on your end.
Okay, awesome. And I think you also kind of mentioned around facilities using the platform being more compliant and noticing their compliance going up. Can you maybe talk a little bit more about how the platform helps improve compliance?
Yeah, definitely.
Go ahead, Matt.
Yeah, so one of the areas that we focus on, with our customers is helping them utilize House Mom as a compliance tool, because facilities are looking to help leverage the communication channel to document the communications that are taking place, and we do that automatically. So not only do we help them document the communications, but we can also push those back into the health records so that they have a single source of truth. So we're often a tool utilized to help show communications during state surveys. If you have surveys and surveyors into the building, it's that one place that's compiling all of the documentation of your communications without creating any additional work.
Mm-hmm. Okay. Yeah, and I know we got just a little less than 15 minutes here in our allotted time today, so just want to give one last call for questions out there. I think we still got just a few more to get through, but if you have any questions in the audience group, please feel free to get those in here as our last call. The next question is, you talked about building a network that's becoming more so like the standard of care and how your customers are using it to increase their admissions. Can you share a little bit more about how that's actually working across the customer base today?
Yeah, definitely. Great question. With the House Mom app, family members and residents have expectations now coming into different types of communities and facilities. They want the convenience and the information and data to be available to them, right? Especially care POAs if you're making care decisions on behalf of a resident, or if you just want to check in on your loved one. Say they're living in an independent living facility and you want some engagement, be able to see what they've been up to, what they're doing. Building that network is really the foundation of that, is peace of mind and trust. And we're getting a lot of families who have loved ones in these facilities and communities on this network nationwide. And it's becoming kind of that expectation and that standard of care, because once they get this information accessible to them, that's how they want it, right? And it's becoming their expectation. And we're showing that we can help bring new residents and new admissions into facilities to build their census. And really say our facilities are embracing it and getting their sales and marketing teams, aware of the House Mom tool, and being able to show that end user experience of, hey, if you come to our community, this is what you can expect, right? This is the type of level in our commitment from transparency and customer service. You'll have access to this information and be able to utilize these tools. And it's really been effective in that way. I think a lot of our customers have embraced it and are really promoting it in a pretty powerful way.
Awesome. Okay, I got one more question of my own, just from my own observations in the work that I'm doing. But I guess, in my opinion, I think one of the biggest attractors for House Mom is the impact that it has on staff. And I think we've seen some really impressive statistics and customer testimonials. But my experience has been with some providers today, they're just really hesitant to implement a new product just because they might be afraid of that implementation burden on their staff, saying we don't have time for anything, even if in the long run it's going to save us time, we're going to be better off. I've seen that hesitancy. Could you maybe speak a little bit more about what the implementation effort looks like?
Yeah, definitely. We do implementations, whether at an enterprise level or a facility level, and support all aspects of it. So we really do a lot of the heavy lifting to where our account manager can train your facilities, roll it out across your organization, or work with the facilities directly. If it's a one-off facility that wants to implement the House Mom tool, we do that quite often. And it's easy. There's, several steps. You already have House Mom if you're a point click care or matrix care user. You just have to turn it on. And once it's turned on, typically there's about 5 days of processing, and we'll have an account manager, meet with your organization and really discuss the functionalities you're looking to enable based off what you're trying to drive. And we'll set up those workflows. We have several steps really to identify the workflows that you want to enable based off the processes you guys have in place already. So, again, we don't want to change any processes or create any additional work. And we'll set it up, in about 45 or so minutes so that it's ready for deployment and really runs in the background. It's pretty seamless, doesn't create any additional work for your facility. A lot of our clients and customers don't know it's there, and then we'll have to do awareness training so that they can promote it more effectively and build that census.
Okay, awesome. Yeah, I know we got less than 10 minutes now, so I'll probably ask one more question here, and then we can kind of move into just wrapping things up. I'm kind of curious myself again, are there any unique ways that any of your customers are utilizing House Mom that may not have been covered in the demo? Are there any communities that might be using it, as a attractor in the sales and marketing process, or as a staff attractor, or any use cases during COVID that you kind of have as a cool story for providers using it?
Yeah, definitely. I mean, we have clients and customers that utilize us in a variety of different ways. I think it's because we have such a broad offering, focusing on the staff communications, focusing on the resident engagement and communications of family as well. Definitely one of our most popular items is communicating clinical information in skilled or AL environments. And we're very, very, very good at that. And, one of the exciting things for us is definitely through family feedback and some of our other functionalities, we're seeing impact on resident outcomes, which is really, really important, right? That's why what people care about the most is we're all there to create the best outcome possible. And through family feedback, we're able to collect new insights and data points that maybe the facility didn't know about that resident. So, whether it be, hey, we noticed she was on this medication and 10 years ago she had this negative side effect, right? That's really powerful information that the care team can then discuss and implement that into a care plan. Or, hey, we noticed that it can be as simple as we notice mom is eating chocolate pudding, after dinner every night. She really prefers vanilla. Or, hey, from a hygiene perspective, can we get some assistance on getting her hair brushed in the evenings? That's the type of stuff that makes a difference, right? And shows that your facility is really on it and, really creating that resident or patient centric experience. And it's going to make your facility stand out. And to be able to get that data and make it actionable, in a format that your facility wants to receive it, because, we talked a little bit about the phone experience. I'm sure a lot of your phones at different communities are ringing pretty consistently, especially, in the pre and post COVID days, when families weren't able to go into facilities. And now, the level of engagement is pretty high, right? Because there's a lot of fear for families and residents. So, being able to build that peace of mind, being able to give the facilities feedback in a way that facilities want to receive it is really important, because it can alter and tailor the care experience that, you know, makes your facility stand out, and, you know, utilizing House Mom as a differentiator. We see that Justen reviewed online scores. You know, not only do we see hundreds of hours saved from a staffing perspective, but really kind of doubling up satisfaction scores is a very regular thing for us, and can help your facilities, you know, attract new residents.
Yeah, awesome. And we got one last audience question that just came in, and then, you know, from there we can go ahead and close out. But can you maybe speak a little bit more around how long House Mom has been around, and how many installations or customers you have today?
Yeah, great question. So we've been around since about 2015. Was one of the early partners over at Point Click Care, Matrix Care as well. We've worked with hundreds of facilities in assisted living, independent living, and skilled. And I think the number currently is growing, and it's 36 or 37 different states. So we've been around for a while, and have quite a few customers that we've serviced. We have large enterprise customers in the top 10 largest providers in long-term care, 100+ buildings. We have other customers and clients that are 60+ buildings. And then we have some that are 1, 2, or 10 or 15.
Awesome. All right. Yeah, and I know you guys are always super busy at the conferences that we've been at together. I think I've told Justin I don't want to be at the booth next to you guys, because we'd have too much overflow into ours. So there's lots of interest in that regard. I know you guys always clean up there. And I can tell here too from some of the questions coming through, there are some customers already of ours asking for further demos. So I guess to kind of wrap things up here, I wanted to restate that we're going to have this recorded and ready for repeat viewing, or for anyone to share with their team through YouTube. So we'll get that out within the next few days here, and just kind of send that out via email, probably on social media and everything as well. And I guess, for next steps, if I can help answer any questions, if you want to email me and I can connect you to House Mom, great. But Bob and Matt and Justin, I want to let you guys kind of close us out too. And if there are any next steps or any customers interested in a further demo, what you all would advise.
Sure thing, I'll jump in there. This is Bob Cummings. Thank you, Steve. As you said, if folks want to reach out to you, I know you'll bring them to us, but otherwise, if you want to email me directly, it's bob@housemom.net. Steve, do we have that on the next slide, perhaps?
Yeah, Matt, is that? There we are.
Yeah,
There we go.
That
I'd be
darn
happy
demo.
to do a demonstration for you, and I would look forward to that opportunity.
Awesome. Yeah. Well, hey, thank you everyone at House Mom for showing us around the solution and answering some of our questions today. And thank you for everybody who joined the webinar today too. It's really great to have your interaction and have so much interest in what we're looking at here with House Mom team, and appreciate everyone's time. And I guess I'll turn it over to House Mom to say goodbye as well.
Thanks, Steve, and thanks everybody out there. Really enjoyed our session today and look forward to talking with you. Have a great day.
All right. Thanks, everyone.
Thanks, everyone.
Thank you.